Well, from one voice of reason and rationality to another voice of reason and rationality, it's my very great pleasure to introduce Charlotte Deane. I've known Charlotte for a number of years. We shared the collective misery of both being heads of department at the University of Oxford. She escaped that challenge in 2019. And she then moved over to EPSRC, where she's the Deputy Executive Chair. If you're not aware, EPSRC, the Engineering and Physical Sciences Research Council, one of the main funding councils in funding organisations in the UK. Since March this year, she's been the COVID-19 Response Director at UKRI, the UK Research and Innovation Group. The overarching research and innovation group for funding research in the UK. In her day job as a professor at Oxford, a very distinguished professor at Oxford, she is the head of the Oxford Protein Informatics Group, a research group in the Department of Statistics, which has over 25 people working on a diverse range of problems to do with protein structure. So Charlotte, it's a very great pleasure to have the opportunity to introduce you, and we look forward to hearing about what you have to tell us about your role here. Thank you.
Thank you very much, Mike. I'm going to try and do the share screen and hope it goes well. So there's my share screen and I'm seeing thumbs up, so I'm presuming I'm doing okay. So good morning, and first of all, thank you. And thank you to the Turing for organising the event today. I think it's a really great opportunity to think about how data science helps with all of this, but also to see how we might have got it slightly wrong in places and how we could do better and what we can do next. And thank you for asking me to participate as well. So the title of my talk is a sort of, I think, slight exaggeration, because I don't think I can tell you how to effectively, rapidly fund new research during a pandemic. What I can tell you is what we tried to do, and I can tell you some of the things that didn't go as well as we hoped they would, and some of the things that really did seem to work. And I don't think I could quite tell you what I'd do differently next time, apart from maybe hide slightly better so I didn't end up in charge of trying to make it all work. So as Mike said, in March, I became UKRI's COVID-19 Research and Innovation Director. What that meant was that I was trying to coordinate what basically is the largest public funding body to do coordinated research and work out what we actually needed to do across the space of the pandemic in terms of research now, research later, and remembering that everything was happening within a very constrained budget. So we didn't have a lot of money to play with to make this happen. And so the first big question is, what do you fund? You know, people always think, well, you think about the mechanisms, you don't. The first question is, what do I actually need to fund? And how can I then allocate those resources to those areas once I need to know? So trying to set those priorities, particularly in the early days, was really hard. We had lots of information coming in, and a lot of what I did to start with was to try and get to know these people. So talking to people from SAGE, having a direct link into the Go Science department, but also you've obviously got the National Institute for Health Research, so NIHR, is doing a great deal, and we need to know what they're doing and how we link with them, talking to the government chief scientific advisors, the CSAs, but also the international response, because actually, every country has a kind of constrained budget. So we need to know what's happening around the world in terms of what is sensible research that the UK should be doing, what is research actually, though we'd love to do it, we shouldn't be doing here and will happen in the rest of the world and we'll get to see the results. And what is research where we need to partner with the rest of the world to make sure that it happens and we're part of this. And the way we tried to get through this what to fund question was we set up, and you had to call everything a task force at this point in case anyone hadn't realized. So it was obviously the UKRI CV19 task force. And it was, I had to keep everything small, a small group of people, but who had expertise across as many research areas as I could and were plugged into as much of what was happening in the landscape. And that wasn't just what was academically happening, it was also trying to plug into all the different parts of the government. So the devolved administrations, because they have devolved responsibilities for much of what was happening. And also, once again, the Government Office of Science. And this slide is slightly old because there were, I hope most of you are aware of things like the National Core Studies that started, but making sure we were plugged into what was happening there. And then we had a group of us inside UKRI, and this was perhaps my biggest challenge, to try and set up a call that was across the entirety of UKRI. Those don't exist. And just to give you an idea that they really don't exist, there is no computer system within UKRI that allows us to do it. So you can't have a UKRI call. You can have an EPSRC call, so an engineering physical sciences call, or a medical call, or a biological sciences call. So this was, I was surprised, but an unprecedented challenge. And part of this was actually, how do I make all of the different 9 research councils, and that includes Innovate, which funds business, at least to the outside world, make up an offering that we could say, we want to hear your best ideas, we want to work with you to do stuff, without creating artificial barriers between disciplines. And that artificial barriers between disciplines was something we really had to make sure there wasn't, because as I'll show you some of the research, it became more and more apparent that the most important questions we needed to answer really did need teams of people across different disciplines to do them. And the separation was quite a dangerous thing if we couldn't break it down. And then you actually, once you've got all of that, you have to think about how you're going to fund it. There are 3 main kind of delivery options that we did. The first one was the use of the long-term strategic investments that existed, because then you can redirect large resource you already have to address challenges as they arose. So in fact, the Turing was part of this. I suspect there are several people on this Zoom who were part of the kind of moving their research to a different area to make something happen, because we already had a large cohort of people who were able to do that. It's very rapid, but you have to be careful, because your investments in your strategic places might not actually be capable of the research you want them to do, even though they really want to help you and do it. So this was one of the massive challenges about all of this. Pretty much everybody wanted to help, but that meant lots of people were volunteering to do things that they weren't really the right people to do. And a big part of our role was to try and ensure that it was the right groups of people as far as we could. And that comes to the next method that was used. Now, UKRI used this a bit, but this was used far more by other organisations, which is directive establishment of kind of research that is commissioned effectively. So rapid establishment of something that will address a critical question we need to know an answer to. And this is challenging because it's culturally challenging. Actually, most of our community, if you think about the academic community, does not like to be told, do this now and tell me the answer in 1 week's time, unless it's something that they already wanted to do and knew how to do. And the other challenge always with directive funding, and it is a very difficult challenge, is if you want to go that fast, it's very difficult to ensure that funding reaches the best people to do it. And it's difficult because I know a lot of people in the community, UKRI has a wide network, but we don't know everyone. And we certainly don't know necessarily the right person to do every piece of research. I think that's an almost impossible task. So doing that well is very challenging. And then finally, what turned out to be our most powerful tool was responsive. And I think this says a lot about the community of researchers in the UK, that what we did was we created open calls. Sometimes we would have a kind of strategic initiative in one area or another, but we called out to the community, we asked them to apply fast, against specific challenges or just against things they thought were important. And they did. And what we got from that was huge response from the research base, but also a way of getting really great research done, even in areas that if you get all that top-down information that I was getting, you didn't necessarily know existed. The issue with this is, of course, we all have our own favorite subjects. So I love working on one area, other people love working on others. And that can make us not great at really answering the big questions. And the other thing is a very rapid instance on delivery here. So we cannot wait until I can wrap up every result and tie it in a bow and publish it in my favorite journal. I want to do that as well. But if we're going to help in this, there were times when we needed people to talk about their results to those involved in policy, actually with all of the caveats that David's just explained was so important around this. We need you to explain to this group of people, but we need you to do it whilst explaining why it's only partial information. But at this point, partial is better than none. So how do you do all of that and ensure that what you fund is good? Well, basically, that's the biggest challenge of all. So we drew on processes and things that had happened before. So we, in a sense, I'm not going to say lucky, but we had worked before, not me personally, but UKRI, on having rapid response calls for things like Ebola and Zika. Now, those were mostly just medical when we were doing those calls, and often they were international, but they gave us an idea about how you do this. Most of the councils had funding with urgency procedures that we could adapt. And we tried very hard immediately to start signing up to very things that would make it clear what kind of research we wanted. So the statement on sharing research data and findings relevant to novel coronavirus, because it's very important that we wanted people who were applying for funding to know that what we were funding was public research, and we wanted the information out, the data available, so it could be used by everybody. And so we needed to make these statements right at the beginning, otherwise it's too late and people don't realize. And to give you an idea of how fast this was done, the first call was agreed with the Department of Health and Social Care, and that's joint. It was mostly the MRC with them. It took us only a week to get that from, we want to do this, and it was launched on the 4th of February. The second call, which covered the entirety of UKRI, which we decided to do towards the end of March, it took 4 days from the moment we said we want to do this to having a call out and for people to actually be able to apply for this. And all of this we had to do continuously changing and adapting. You couldn't have one system and say, I didn't know in March what I needed the system to look like now. And I certainly didn't know in March what the main research questions were going to be now. We knew in March what some of the questions were then, but it was continuously adapting. So there have been several calls that have been opened. The very main one is the one I will talk about most, which is the UKRI Open call, because that was the biggest call we did. But there are also things like the GCRF Newton Fund, that is for international response to. We were trying to do work with developing countries and other areas to try and ensure that this didn't become a kind of very insular effort in terms of this. And as I said, within all of this, we had to keep highlighting, pulling out topics that were important. So I'm hoping some of you have seen these, like the topics around ethnicity, transmission, and mental health. And we also had longitudinal studies to try and start those off, because we need to start those in March, so we will have the data for a long time, so that by now we can actually make statements about, you know, what we think things like the death rate from COVID is. It's these kind of studies that allow you to do this. Just to kind of put this in context of how we were working. So the first call opened, as I said, that was in February, and that first call had 272 applications, and we made 26 awards. Once we had the large call open, if you look at the bottom of the slide, the UKRI, that was 2,000 applications in about 5 months. We were trying to get to a 2-week turnaround. We certainly didn't manage that at all points in time, because it was very much pressured on the system. And slowly, as time has moved on, we've now moved to a 4 to 6 week turnaround, about 3,000 applications. So you can see the scale, and we're now moving across. So for those of you who are interested in all of this, 15th of December is when the very rapid, the rolling call of the 4 to 6 turnaround is closing, and we're moving to the next mechanism. And this is what I mean about this continuous process of moving against you've got a moving target, but you've also got a system I've got to keep alive to try and be able to fund these things and find the good stuff from all of this. So the initial phase, this was all about trying to do it as rapidly as possible. We wanted to say, could we actually process a grant in days? Now, any of you who've ever applied for a research grant, me included, will know that you have continuously put them in, and they say, I mean, when I first asked this, they said, well, we usually manage this within sort of 3 to 6 months. And I was like, there have definitely been times I've put a grant in, I've had nothing back for 12 months. I don't think I'm special. I think this happens. And I wanted to put in place a technique that we're aiming to get it done in 2 weeks. And that involved massively shortening the application form. That wasn't just actually for our benefit. That was mainly for 2 people's benefit, which were outside UKRI. That was to make it easier for people to put ideas in rapidly, but it was also to make it easier for reviewers, less to read, can this be done? Is this sensible? Because we can always get more information, but if you can judge it off that, we can keep going. And it was initially really great when the information was limited and the landscape was empty. Of course, it became less useful as much more data became available and people needed to talk more about how they would fit into that landscape. And one thing I want to say here is we made quite a lot of mistakes with this form. This form developed through time. And one of the biggest was something that I didn't even think about, totally honestly, was we were stripping out as much as possible. And one of the things we stripped out was any ED&I information. So we did not ask any of the kind of standard questions you would ask there. And that was a mistake. And it was a mistake because it would have made no difference to the reviewing. It would have made no difference to our panel's ability, but it has made a difference for us to understand the effect of doing this kind of funding on the system. We are doing that now, I should say. We have been collecting it for some time, but we weren't doing it when we first started in March. It's been an evolution. So at one point, there were some grants that we were just doing by panel to get them through as fast as possible. Then we were starting to move to colleges of experts, external review, then making sure we have full external review and trying to ensure that at all points we're doing as much as we can to assess whether these things are possible and whether they are the right research to fund. To give you an idea of the scale, I've got 2 numbers on here and I think they really help. In the UKRI NIHR call, across its sort of 5 months that it existed, there were about 1,000 applications came in. All of those were assessed by the MRC. The MRC usually only receives 1,800 applications across its entire portfolio in a year. So if you think about what that has done to the people in the MRC, they're still doing that 1,800, but 50% extra at speed, and also their review community, the academics who had to review all of these. So there's a lot of people involved. So the thing I have to say at this point is thank you. Anybody who reviewed any of this for us, thank you so much, because I recognize that we were asking you to do things when there were a lot of other stresses on you too. But it was a really big thing. So to give you an idea what that means in terms of review, if I go to the EPSRC, in the first 5 months, we made nearly 2,000 review requests, because of course, not everybody we ask responds. So it's a huge burden going on there. So the scare on all of this was always the burnout. Could we keep going at this pace? Could we actually make sure it happened? And then the final part, which I can talk more about in questions, is how we then monitor that we've actually done the right thing with all of these grants. So I'm just going to finish by saying a little bit about the research, because it cheers me up to say that was an output from all of this. It wasn't just one big process, mad, lots of people talking to each other. If you want to see it all, one of the things I also put together, well, I didn't build it, but I got it built, is this, which is a topic map. It's totally publicly available, so you can go and look, of the research that was funded. And it is automatically updated. And that's what I wanted, because I wanted a system where we could release the information very rapidly. We started with a flat spreadsheet, but people could search it very easily and intuitively. And they were like, oh, we'll need to all classify this. And I'm like, that will take months. It's got to go out every single week as we release grants. We've got to be able to show people what we are funding, where it's being funded, and how it helps people. And then very quickly, because I know I'm out of time, but just to show you a little bit about the projects that we funded. So I'm hoping that most people have heard the news about the Oxford vaccine. It made me very happy. That was started by some initial grants that were given out from the rolling call, and it was based on UKRI funding before that. Things like the continuous positive airways pressure devices, where UCL managed to go from, we've got a concept, we need more of these in mid-March, to delivering 10,000 of these devices to the UK government by mid-April. And actually Mercedes, as in the car company, were incredibly helpful in manufacturing those. And then longer term things like looking at wastewater surveillance, or trying to understand what's actually happened to people working in the NHS, and how capturing that for the longer terms we can analyse it. And something that I think all of you might find really interesting is a huge survey that's been going on, which is the Life with Corona survey. Some of my favourite insights from that are young adults tend to actively perform many behaviours to counter the pandemic. So if you're going to counter the pandemic, it's young adults who seem to be doing something that will make them feel better. The next one's slightly less good to say out loud. People around the world want a vaccine to be available globally, with the exception of people in the USA. And then finally, younger people are more willing to pay to stop the spread of disease than older people. And I'm not sure quite what that says about the different types of populations, but I think really at the moment it's a capturing of how people are feeling and what is happening. And I would say another data source that data people need to look at in terms of thinking how all these things work. So with that, I will stop, and thank you very much.
That was brilliant, Charlotte, and almost supernaturally good timing. Thank you so much for doing that.